Vitamin D deficiency rickets is a global issue currently. A child needs how much? 400 IU up to 1 year. Afterwards, they need 600 IU. But a good amount of food has doesn't have it. And when do food have it, but the child's absorption is dubious and deficiency is for unknown reason. It's quite common even in the West. It is quite common. Even in the well-nourished children, well-grown children, so this reason of deficiency is global. It's not in the disease in the West or East. Everywhere vitamin D deficiency is there. It's around how much? 60%, 50%. In good amount of time, it is much higher, 70%, 80% in the developing nations. So food like the rich foods, sea fish, and then and fish oils, green vegetables, milk and milk product, they have higher amount of vitamin D. Despite having this food rich in vitamin D, child can have deficiency vitamin D, and so globally people fail to meet the vitamin D deficiency, but thereby it's essential to have this little bit of disorder and calcium deficiency concomitant because of the same region is prevalent. So so when the child giving has this pain this and that side, you can give vitamin D and calcium, periodic supplementation or prophylactic dose you may give, especially the breastfed infants. The mother's milk contains how much? 15 to 40 IU vitamin D, but child needs 400 IU. So thereby, every neonate and infant should be supplemented with 400 IU daily until he grows. Afterwards, it depends. If the child has little bit of symptom or little bit of pain, this and that, you should give vitamin D 600 IU. In treatment, the dose is a little bit higher, 1000 IU to 10,000 IU, depending upon the age of the child and the weight of the child. So cover vitamin D, even sunrise exposure, food intake, every the measures to manage vitamin D deficiency throughout the globe miserably fail to reduce to have the normal vitamin D 100% proportion. It is not achieved. So people are thinking why it's not happening. So whatever they are, until unless we get this answer, we go on giving the vitamin D and calcium and healthy behavior, sunlight exposure, exercise, and your non there is a non-causal relationship between the your diabetes, hypertension, CKD, and malignancy, even immune disease, immune deficiency, asthma with hypervitaminosis D. The exact relationship, why do they occur in vitamin D deficiency, is not certainly known, but they do occur. Thereby, the optimum vitamin D level in a person above 30 nanogram per DL is essential. Then measuring periodical is not bad. More important that healthy lifestyle, healthy food, your sunlight exposure, and your calcium rich food, vitamin D rich food like milk and milk product, fish oil, small fish certainly they are essential.